Thank you so much, Mr. Vice Chairman, for chairing today's hearing on this really important topic. The novel coronavirus, as it has swept across the nation and worked its way around the world this year, has left a veritable trail of devastation in its path. It's imposed not only serious physical disease, but it's also imposed severe economic ills as well. Jobs have been lost, businesses have been shuttered, and entire sectors of industry have been disrupted. In response to these unprecedented issues brought on by this fairly unique crisis, we've taken unprecedented government action. But as in the successful treatment of any illness, we have to make sure that we're using the proper remedies and that we first do no harm. So, as we take stock of our current response to this pandemic, we need to consider how policy has both hurt and helped so far and what we can do to improve, what might be the right solutions moving forward, both for this public health crisis that we're dealing with right now and for whatever might come next, whatever might lie in our path in the future. Well, some have called for still more aggressive federal responses through more stimulus, a nationally coordinated response led by the administration, and more widespread lockdowns. The benefits of policies like those have to be weighed against the cost that they impose on society, economically and otherwise. Is there a whole host of possible unintended and, in many cases, unpleasant consequences? For instance, we know that large-scale stimulus can have a tendency to exacerbate our already whopping national debt and can have a tendency to crowd out private investment. Additionally, the enhanced unemployment benefits included in the CARES Act provided a disincentive for those who were unemployed to return to work, thus inhibiting economic recovery. In addition to economic devastation, lockdowns have had other negative effects by their very nature. Mandated isolation has either spurred or in some cases worsened mental health issues for a lot of people. And it stopped countless others from getting routine health screenings and vaccinations, prohibited or discouraged others from maintaining their health in other ways. And in these respects, it has, in and of itself, caused death or illness that might not otherwise have happened, that might otherwise have been prevented. In fact, as the second wave of the coronavirus has been rebounding across Europe, the continent's governments are now intent on avoiding any large-scale lockdowns and instead are focusing on more tailored, more localized measures to combat outbreaks as they happen based on the knowledge they have from day to day on how best to manage infections. Finally, we ought to make sure that the any federal policy adopted in Washington is certainly not inhibiting sound and effective solutions. Unfortunately, evidence shows that it already has, especially in the early days of this particular crisis. For instance, outdated certificate of need rules prevented hospitals from acquiring new beds and equipment. And the FDA and CDC rules against at-home testing posed an early barrier to disease control. But perhaps the worst failure of all was something that involved the sheer bureaucratic chaos that fatefully delayed effective testing for an entire month. Now, thankfully, we've already removed some of these barriers, some of these regulations that were stopping us from making the progress we otherwise needed to make. Two important changes have been allowing doctors to practice medicine across state lines, as well as allowing doctors to provide care through the use of telemedicine technology. This is exactly the kind of regulatory flexibility that we should consider moving forward so that we can quite quickly and freely administer to those whose needs require it, regardless of where the provider might be and regardless of where the patient might be. As we continue to respond to the coronavirus, I think we need to acknowledge the ways that sweeping, centralized, one-size-fits-all federal policies can ultimately worsen our attempts at recovery. If we are to have flexibility and resiliency of the sort that we need in the face of this crisis and when faced with whatever might come our way in the future, we ought to really instead empower our states and localities, which best understand how their own resources, their own needs, and their own communities can be addressed and devoted. The American people have always played a critical role in governing locally, volunteering and innovating to respond, especially in times of crisis. I look forward to hearing our panelists' contributions today as to how best we can continue doing just that. Thank you.